welcome to today's episode of Health Mantra brought to you by Manipal Hospitals. I'm Heather, and today we're going to be talking about what is often called as the silent epidemic. Yes, type 2 diabetes. Now, although it is known as the disease of high blood sugar, that is not all it is about. Because left unchecked, there are several health complications that could occur. Now, joining us today to tell us exactly what these health complications could be and how we can take better care of our health is Dr. Pokale Mahadev, an MD in internal medicine at Manipal Hospitals, Goa. Dr. Pokale has extensive experience in cardiodiabetic care and focuses on managing and preventing such cardiovascular and metabolic disorders. It is this commitment that makes him the perfect guest for our show today. Hello, Dr. Pokale, and welcome to the show.
Nice to meet you.
To begin with, Doctor, could you tell us what exactly type 2 diabetes is and how it differs from, say, type 1?
Type 2 diabetes is a metabolic, in general, if we say diabetes, it is metabolic disorders that are common phenotype is hyperglycemia, that is high sugar. It consists of various types. Type 2 is mainly because of insulin resistance and increased blood sugar levels because of low or high insulin levels in the body. The type 2 is mainly autoimmune related disease, and it is mainly destruction of beta cells in the body, which leads to decreased production of insulin and further causing diabetes, that is hyperglycemia. So these are the main difference. Main is lifestyle disease, other is the autoimmune disease that is causing hyperglycemia.
So type 1 is not autoimmune.
Yeah.
Type 2 is lifestyle.
Lifestyle, we can say. Yeah.
But is it genetic? How much of it is influenced by genes? Are we predisposed to it, or is it merely a lifestyle disease?
Yeah. And type 2 diabetes is a heterogeneous disease. Multiple factors are involved. So most important factor is environmental and lifestyle factors, and genetic factors are also involved in it. If a parent is involved, if one or either of the parents are involved, then the risk of diabetes is around 30 to 40%. And if the sibling, twin, is involved, then 60 to 70% risk of diabetes is present in an individual.
Does weight also play a role? Can a thin person, for example, have diabetes?
Yeah, he can have diabetes, but the chances of thin person developing full-blown diabetes is less likely compared to a obese overweight person. So a thin person can have diabetes. It may be because of some complication of pancreatitis or any other autoimmune diseases, or late onset of type 1 disease that we commonly say nowadays LADA, the late onset of type 1 diabetes. So thin person can, his diabetes can be seen in thin person also, but in obesity or overweight patients, this is more likely.
The incidence is
high.
What about things like stress? I mean, we live in a highly stressful world right now.
Stress is also a most important factor. Stress usually tends to increase the stress hormones in the body, like steroids. Steroids further elevate the blood sugar levels, and chronic stress will increase the baseline production of steroids in the body. That will further increase in blood sugar levels and cause hyperglycemia and diabetes and further complications because of it.
Okay. Doctor, there was another term that you used, which is insulin resistance. Can you tell our viewers what exactly do you mean by insulin resistance?
Insulin resistance is mainly the other term, if we exaggerate it, it is like insensitive to insulin, not sensitive to. That's why body is producing sufficient or more insulin, but that insulin is not sufficient enough to bring down the blood sugar levels. That's why hyperglycemia and type 2 diabetes is produced. So in patients with type 2 diabetes, the patient may have low insulin levels or even high insulin levels, and still he is diabetic because of it, that present insulin is not working properly. In initial phases, most of the patients have high insulin levels, and later as the disease progresses, the pancreas and the beta cells in the pancreas, they get exhausted and they die off, stop producing it, and patient will go in continuous diabetes, and it will be not reverted back, or patient may not go in remission.
Doctor, another thing is, I mean, nowadays there is so much of awareness everywhere you go, whether it is television, whether it is internet, and people are also more aware, you know, that they need to take better care of their health. They're exercising more, they're eating healthier. Shouldn't we have seen a decrease in the incidence of diabetes? Are we seeing, you know, is the trend showing a decrease, or are we actually seeing more
No,
cases?
the trend is increasing, especially in India compared to other countries like China, US and Western countries. The trend in India is increasing at an alarming rate. Initially, it was 9% in last decade. This decade, it's around 10.5, and it is predicted by 2050 it will be around 12 to 13%, the prevalence rate. So it is rising, and the main factor that is causing this rise is sedentary lifestyle, increased stress levels, and decreased BMR levels and obesity.
So even though people are aware, there is still more. There are cases rising every day. There is another term that is often heard when you talk about diabetes, and that is pre-diabetes. What do you mean by pre-diabetes?
Pre-diabetes, if we can say, is impaired glucose in the patient. Means if the blood sugar fasting is 100 to 140, that range we usually term it as impaired glucose. So impaired fasting glucose, and such patients are pre-diabetic. Or after food, if the blood sugar is within 200, from 140 to 200, then we say impaired glucose tolerance test. After 75 grams of glucose, if the patient is not able to suppress the blood sugar levels, that patient is pre-diabetic, and such patients can be reverted back to normal, but they may progress to type 2 diabetes at any point of time.
So it's like your warning light.
Warning light, yeah. So he is not having the disease, but he is more likely to have disease in near future. So in such patients, screening annually is more important. Better to, according to the guidelines, every 3 years the screening is supposed to be done in such patient. But I recommend annually at least everyone should get it checked. At least the blood sugar levels and HbA1c levels.
Because unless you get it checked, you don't know whether you're pre-diabetic, whether you are diabetic.
Yeah, the most important thing with diabetes is, for diabetes and hypertension even, these are the silent killers. A patient may be suffering with diabetes for long, he may never get to know, because the signs and symptoms of diabetes, these usually develop after 5 to 10, 10 to 15 years later of the onset of disease. Means patient will be not knowing that he is having diabetes, because there is no signs and symptoms that he is having diabetes for initial 10 to 15 years.
So that is another thing. There are many people that go undiagnosed for years and years together.
Most of the people. Yeah.
And the only reason they come to know is when, you know, other complications arise. Is there any, you know, a warning sign? How do I know that I need to go test myself, say, get a blood test done?
Warning signs are mainly developed after the complications are full blown. For
Which
example,
is already too late.
Already too late. So screening is the only way a person can detect his own status, or a doctor can detect that a person is having diabetes or he is not. Because first sign is urine is producing, body is producing too much of albumin in urine. That is the first sign people get to know, that increased thirst, increased foamy urine, producing foamy urine. This is the initial step. But this step comes around 10 to 15 years later, the disease, later the flow of disease. So screening is most important part, I feel.
Besides, you said thirst and foamy urine and excessive urination, are there any signs that, you know, people can watch out for?
Increased thirst, increased urination, loss of muscle mass, increased hunger. These are also the signs of diabetes, we can say.
You know, how about things like eye exams? Someone that I knew was told by the ophthalmologist that they could have diabetes. What does, you know, high blood sugar got to do with your eyes?
Yeah, eyes is the first organ to be involved in diabetes. In diabetes, usually causes the destruction of the blood vessels in the eyes, because blood vessels in the eyes are so fragile that they are the first target for diabetes to be destructed. So there are mainly two types of diseases. One is proliferative and other is non-proliferative. So first type is non-proliferative retinopathy. In this, there are vessels in the eyes, they get dilated. because of continuous hyperglycemia. And the other thing is because of continuous high osmotic pressure in the blood vessels diffuse sugar inside the eye, and the eye may get dehydrated, and that's why the patient may develop blurry vision for some time, which is reversible after the sugars are well under control. But if the retinopathy has developed, if it is grade 1, 2, 3, or but in the initial stage, it is reversible by treatment like photocoagulation, VEGF injections. But if it is progressing, then it may cause blindness in such patients.
Now this, like how you said, you only would come to know, even if your ophthalmologist tells you, it is by that time it is already too late.
Yeah.
So you said that we need to get screened every year.
Yeah.
Is there a particular age that we need to start screening ourselves, and how, what are the tests that are involved?
If the patient is type 1 diabetes, if it is diagnosed, then at least within 5 years he is supposed to be screened for retinopathy. But if the patient is type 2 and he is developing albumin, producing albumin in the urine, then immediate screening is required in such patients, because usually nephropathy is the later complication of diabetes. Retinopathy is the first complication usually seen.
And at what age do we need to start screening for diabetes? If we're going to do an annual screening, is there a certain age that we need to start, say 30 or 40?
It's 45. After age of 45, if the patient is fit, if the person is fit, then he should screen after every 3 years. Okay. Even if he is fine, if the blood sugars are well under control, then he should screen every 3 years. But if the person is obese, if his lifestyle is sedentary, less physical activity, no exercises, then such patients should screen themselves annually.
After 45?
No, whenever possible. Even if the patient is in his 30s and he is overweight, then annual checkup is better to be done.
Okay.
But if he is fit, then after 45.
And how, what kind of a checkup, are there any reliable at-home tests, or is it always a lab test?
At-home test is also a good thing, but I'll prefer go to a lab and give a fasting PP, HbA1c and urine routine. This is the basic test I will prefer, just to monitor at home. If those are abnormal, then someone may consult a physician or nearby doctor for further management of diabetes.
Okay. Now, diabetes is also known as a progressive disease. So, if left unchecked, it affects your heart, it affects your kidneys, it affects other major organs. Could you explain how, high sugar can cause damage to organs, your major organs?
Yeah. The high sugar mainly damages in two ways. High sugar will increase the fat content in the body. Fat depositions will secrete, adipose tissues will increase first of all. Adipose tissues will secrete fatty acids in the blood, and these fatty acids will get deposited in various levels of the body, from the cellular level till the vascular level, we can say. In the cells, first of all, in the cell on the wall, there are multiple receptors inside and outside. These receptors get damaged because of these byproducts of the adipose tissues. Second thing, in between there is a matrix from the cell to the blood vessels. This matrix is also affected, and blood vessel, inner layer of the blood vessel, this is affected. These three layers, when they are affected, are at risk of atherosclerosis, means the blood vessel individual, it gets hardened and plaques are formed. Okay. So this is the basic thing. Further, in the heart, small blood vessels will be affected. That will patient will increase the risk of coronary artery diseases. Okay. In kidneys, same, the blood vessels are harmed. Patient will develop nephropathy. In lower limbs, same, if the vessels are involved, so lower limb ischemia, delayed wound healing, nephropathy, neuropathy. These are the main complications. And in muscles, the fatty acids get deposited in the liver. It causes decreased tendency of muscles to absorb sugars. That's why muscle loss is also there. And in the heart even, fat is deposited. In liver, the fat gets deposited. That's why it can't sense the insulin plus the blood sugars. That further causes increased blood sugar levels.
Doctor, we spoke about complications arising out of high blood sugar. We've spoken about the heart, we've spoken about the kidney. What about, say, your gut or your GI tract? Are these also affected?
Yeah, these are also affected. Gut is also affected, mainly stomach is affected because of parasympathetic and sympathetic nervous system is involved, which is in early satiety. Patient is not able to eat food properly. Gastric, because of that gastric refluxes is seen. Delayed emptying of the stomach. This is the main complication. That's why patient goes in anorexia and weight loss. Second thing is gut is also involved in females, in males, urinary tract, recurrent urinary tract infections, and infections in the genital region is very common with because of any fungal or bacterial infections. The other thing in males, erectile dysfunction, retrograde ejaculation is the first sign of diabetic neuropathy, and other sign in GI tract. If we talk about alternative with constipation and diarrhea is also seen in few patients because of neuronal involvement. Patient may develop diarrhea at night and constipation during daytime because for a few hours he is not able to pass anything. So just alterations.
Are these early signs or this is way later?
In between we can say, or towards the later side spectrum of the disease.
What I'm trying to say is, can we take these as symptoms? Are we allowed to look at these as symptoms of diabetes, so that we know that, perhaps go get screened, you could have diabetes?
These we can say as the symptom of advanced disease. So disease has progressed to the advanced stages, and these symptoms are there. These are like an indicator that the disease has progressed. One more sign in diabetes is bladder contractility is also hampered because of nervous system involvement. The muscles are not able to contract the urinary bladder. That's why retention is seen, and retention further complicates the urinary tract infections, and patient may go in further complications like pyelonephritis. Continuous progression of the disease, the bladder size may further increase, and a patient may not be able to pass properly urine.
Doctor, you said something about slow wound healing, which is another thing that we hear most often in people with diabetes. Why does this happen, and can you tell our viewers what they can do to take better care of, especially feet? I mean, it happens usually, the wounds are on the feet.
Diabetes is the most common cause of non-traumatic amputation in patients. Non-traumatic means without any trauma, the foot is cut off because of diabetes. The most important cause is neuropathy. Distal vessels, blood vessels plus nerves, both are affected. Neuropathy is nerves are affected in the lower limbs. That's why sensation of the limbs is reduced. Even if the patient is getting pricked by a small, even by a small thorn, he will not be able to get to know because of that neuropathy. The other thing is autonomic nervous system is also damaged because of hyperglycemia. This is sympathetic and parasympathetic. That's why sweating part is lost. There is dry skin of the lower limbs. The other thing is blood vessels are involved. Because of that, reduced blood supply to the lower limb, that causes delayed wound healing. These multiple factors are involved that is causing loss of lower limbs mainly. Delayed wound healing and loss of lower limb.
By which time it is already too late. I mean, you've already caused damage.
It is too late, because if there is sensory loss, that means patient has developed diabetes at least 15 to 20 years before, and which was absolutely uncontrolled.
So what are the treatment options available to people? Is there anything they can do to take better care of their health?
Yeah, first of all, sugar control. That is the first most important thing to be done. Blood sugar control, and for if we are talking about loss of lower limbs, then wearing proper footwears, inspecting their lower limbs every night before sleeping. That is the most important thing a patient can do. The other thing, if there is any ingrown nails or any small ulcer even, that should be attended properly. No self-medication or any procedures. Patients are not supposed to do anything at their homes. Most of the people, they try to remove their ingrown nails or some ulcers, skin tear, they are trying to remove the skin and all. This is the first thing that you give entry to your entry to microorganisms in the body. So self medication and procedure are not supposed to be done. Get a consultation from a doctor and get it done properly. If the pressure, because of neuropathy, there is asymmetrical pressure on the feet. Sometimes on one side the limb there is more pressure compared to other side of the foot. So this thing also need to be addressed properly, and that is also one of the cause to form ulcers and limb amputation.
Doctor, you'll have something at Manipal, which is, there are two kinds of treatment. Coming to treatment options, you have your standard treatment and you have your intensive therapy. Can you tell us what is the difference between these two?
Yeah. Standard treatment is only treated, people only go for treatment of diabetes. The target is only the blood sugar control. According to latest trial, which is diabetic control and complication trial, in such trial for around 14,000 people, they followed it for at least 10 to 15 years and saw that the complications were further pushed for at least 10 to 15 years. For intensive diabetic management group, the complications free life was for 15 to 16 years, and for the standard therapy group it was only just 5 to 10 years. So if the patient is undergoing proper intensive diabetic management care, he can get a life free of any complications from diabetes for at least 15 to 16 years.
If you do your intensive therapy.
Yeah. And intensive therapy mainly includes not only diabetic control, it also includes hypertension control, dyslipidemia control, micronutrition, plus any hormonal deficiency like thyroid or any other hormones.
So all the related conditions.
We have to look at the not only at the diabetes, the holistic picture, complete human body as a whole, and treat it, because diabetes affects the whole body from our head to toe. Everything is involved in diabetes, so we have to look approach to diabetes as a holistic approach.
Not just reducing your blood sugar.
Our target is not supposed to be just reduce blood sugar levels. It is just keep the person free from any micro and macrovascular complications.
Dr. Pokale, there is increasing evidence linking diabetes to Alzheimer's. I mean, some people even go as far as call it type 3 diabetes. Is there really such a thing?
Yeah. Type 3 diabetes is not a such term officially announced, but nowadays it's said as such because Alzheimer's is seen in most of the uncontrolled diabetes patients mainly. It is mainly because free fatty acids and oxidative stress in the body causes deposition of proteins in the brain, and these proteins are not properly cleared time to time for causing dysfunction in the brain and further Alzheimer's disease. So it is not directly connected, but indirectly it causes Alzheimer's, we can say.
Alzheimer's. Doctor, we spoke about type 1, we spoke about type 2, we spoke about type 3 even. We've spoken about pre-diabetes and all of this. There is another word that is called gestational diabetes. Can you tell our viewers what gestational diabetes actually means?
Pregnancy is usually a stressful thing in a life of a female. Stressful in sense of physical stress. Demand is required because nutritions are supplied to the baby, glucose is supplied. So risk of hypoglycemia, to reduce that risk, body tries to produce too much of sugar, suppress insulin. That is the normal condition. But if that baseline is increased after second trimester of the pregnancy, second and third trimester, it is called as gestational. If it is in first trimester, then we can say it as pre-gestational diabetes, and if it is before first trimester, then it's just diabetes.
Okay.
So nowadays the rise in number of gestational diabetes is seen.
Does it go away once you give birth?
Yeah, it goes away once the mother gives birth to the child, but the risk of developing diabetes in such patients is very high. So at least according to books protocols, every 3 years a female should screen herself for diabetes, but I will recommend annually is always better.
Whether you had gestational or not, or only if you've been...
No, if the female had gestational diabetes, then.
Okay, then screen yourself every 3 years.
Yeah, every 3 years.
Okay.
And if she is healthy enough, then no need to, if she had no gestational diabetes, then no need to screen as such.
Another buzzword nowadays is diabetes reversal. Can diabetes actually be reversed? Is it possible?
In type 1 patients, diabetes reversal is not possible, Only way to reverse diabetes in type 1 patients is by beta cell transplantation is only way, or the other way is continuous insulin injections. There it is not called reversal, but
That is just managing.
managing it. Only way is transplant, because there is no beta cells in the body, so we are
Okay.
just putting from outside.
And that is an autoimmune disorder
Autoimmune disease,
anyway,
yes.
yes.
The other in type 2, if the disease is in the initial phase, if the patient is obese, insulin resistance is there, and there is, in the initial interview I said, maybe the insulin levels are high, but the sugars are not under control. In such patients, insulin diabetes reversal can be done, because insulin is present, but because of resistance, he is diabetic. If we reduce the resistance, a patient may go back to remission, but it is not cured. The disease is not cured. Patient may go anytime in diabetes, again become a diabetic patient. So he has to properly maintain his lifestyle to maintain that remission state.
So when you say remission, do you mean that there is no medication required
Yeah.
at all,
Yeah.
and you can eat whatever you want, or
No,
you still
that's-
need to control?
No, that's what. He can live his life without medications, but strict lifestyle control is required. Strict lifestyle means proper exercise, proper diet, and proper timing of everything. That is important. But he can go without medication, and there is mainly two types of remissions: complete and incomplete remission. Without medication, if the patient is maintaining his HbA1c levels at 6.5, then it's like incomplete remission. And if it's complete remission, then below 5.5, without any medication, he is maintaining HbA1c levels.
But you cannot go back to eating whatever you want. You still need to control and manage.
Yes.
What about, does it depend on how long you've had the disease? For example, if somebody's been suffering from diabetes for over 10 years, can you reverse that as well?
In diabetes, less likely if the patient is suffering with diabetes for 10 years, and he may go in remission, but there is slim chance he may go. In diabetes, there are mainly two factors which are involved. First factor is hyperglycemia, how the sugar is, and second factor is duration of the disease is most important factor in diabetes, where we first see and look at the patient and first ask him what is the duration you have been suffering with diabetes. So if the patient is suffering, for example, for 10-15 years, less likely he may go in remission. But the thing is, we can further control the blood sugar levels and extend his life free from complications.
So I think what you're trying to say is that as long as there is no damage to your major organs.
If the sugar is well under control, then the damage is less. So
I think most important, as you say, is get tested. You need to get tested, you need to get screened.
Yeah.
One last question before we wrap up, doctor. Let's talk prevention. Can you tell us a bit about diet, about exercise, how we can prevent diabetes from happening in the first place?
The most important thing in diabetes is in calories. If we are talking about the input and output of calories, we have to look for how much calories we are eating and what are the calories we are burning. If that balance is well maintained, then less likely you are going for obesity and less likely that individual will end up in diabetes. So calorie restriction diet, intermittent fasting may also, with new inventions and new researches, we have got to know about autophagy and such things. Though intermittent fasting is also a good thing. Exercises, regular routine, at least I'll recommend 20 to 30 minutes of at least walking is also useful, but patient should do it regularly, at least 20 to 30 minutes of walk. Muscle building and weightlifting. This is also very helpful in such patients, because more the muscle mass, more the calorie requirement, and less the insulin resistance. So risk of developing diabetes is also reduced, and if the patient is diabetic, risk of developing further insulin resistance also reduces.
So that was diet and exercise.
Diet and exercise.
What about things like supplements, your B12, your omegas? Do these make a difference?
Yeah, those are the most important thing in, if we say glucose metabolism, B12, folic acid, iron, and even calcium. These also elements are important in the metabolism of glucose. But These are supposed to be only taken if the levels are not well under control. So that's why first screening and further evaluation, these will help in corrections of this micronutrition deficiency. If it is not there, it's not required to be taken if the deficiency is not there. If we have to look for further thyroidism, dyslipidemia, what are the lipid profile, how is the lipid profile, how is the hypertension, blood pressure levels, pulse rate, these also things to be addressed properly.
We're talking about supplements. I remembered there is another thing. It's not really a supplement, but artificial sweeteners. Yeah. A lot of patients suffering from diabetes, since they cannot have your regular processed sugar, they replace it with just an equal amount of an artificial sweetener. Is that recommended?
No. The sweeteners are not a replacement as such. Sweeteners are like a bridging therapy, we can say. Bridging therapy to go sugarless. If you are eating sugar, you can't immediately switch to a non-sugar diet or non-sweet diet. So it's like a bridging therapy. In such people, they can take to a limit for few months or few years, and eventually they are supposed to taper it down and stop. Taking it regularly is not a good thing, and if they are taking in large amounts, is not absolutely not good, because benefits of it are calorie restriction, and it's good for bridging therapy as such. But the drawbacks, the flaws are, it may worsen the glycemic control, it may increase insulin resistance in the body. Further, it may increase the appetite of a person. And most important part is further worsen the gut health of the patient.
So I think, as Dr. Pokale said, the most important when it comes to diabetes is get tested, get screened, manage your calorie intake, exercise. Is there anything else, doctor?
Maintain an peaceful brain.
So that was Dr. Pokale talking to us about type 2 diabetes, prevention and management. Dr. Pokale, thank you so much for joining us here. It's been such a pleasure having you on the show.
Yeah, thank you very much.
If you have any more questions, or if you would like a consultation, Dr. Pokale is available Monday through Friday, 10 a.m. to 5 p.m. at Manipal Hospital in Donapola, Goa. That wraps up today's episode of Health Mantra. This is Heather saying bye for today. Until the next one, stay informed, take care of your health, and keep watching Prudent Media.